So we're going to move on now to starting the day. So get ready. I'm sure you'll have a fabulous day. And I'm going to firstly welcome Dr. Nasser Siabi, OBE, to the stage. Welcome, Nasser.
Hi, good morning, everyone, and thank you for having me today.
I'll let you introduce yourself if that's
Okay,
okay.
of course. Good morning. I'm Nasser Siabi. I'm the Chief Executive of a local company, Microlink PC. We help thousands of disabled people in employment and in education. We help them to achieve their full potential, essentially help them to do the things they can't do because of their health condition. And if I might just go through the presentation, do I have control on this, Simon? Because I need to show, yeah. So my role really is to try to get organizations to be more inclusive, especially for people with disabilities or health condition, which is very timely for the kind of world we live in, especially in the health sector. Post-COVID, life has become extremely challenging on many fronts. If I were, sorry, I'm having slight control with my okay. So, next slide, please. Yeah. Now, diversity and inclusion is not new. However, it has become under the spotlight, and it's become front and center of global focus in terms of improving organizations' performance, partly because everyone now recognizes we are all unique. We are all talented in one way. We are wonderful in certain aspects, and certainly could be a lot better with support and encouragement from our, whether it's our education institutions or our employers. Now, we know from the experience of working in the health sector, it is the most diverse workforce in any industry. And that's definitely some of the benefits of working in the NHS, is that you are working with so many incredibly talented people from all across the world with different backgrounds, and certainly the collective talent that they bring in is just unrivaled anywhere else in the world. However, I think as an organization, as such a large organization focusing on helping the patients and saving lives, they really need to start being a bit kinder on themselves, because being an institution where you're outward focused, often people who are within the sector are not really getting the feeling they love. And I think partly because the institution doesn't know how to do it rather than not wanting to do it. An event like this is a great example where they bring in the focus onto that. So I'm not going to go through why people should be valued for their talent and not for the race or the religion or the sex or the the sexual orientation. Everyone can contribute towards this fine institution. Next slide, please. Well, we've had this issue for many years about should we give unfair advantage to people who are underrepresented? Well, not really. All you're doing is you're creating a level field by raising the platform. You're not really giving advantage to anyone. What you are doing is helping to harness the full contribution from those people. And that could be whether it's people underrepresented due to social economical reasons, intake to university. They have talent, except they've never had the opportunity to display that, and then giving them an extra opportunity to come and do the course in university is actually the way to get those people to shine through. And the same goes when you have people struggling with certain life challenges, and obviously being more understanding of their needs and trying to give them more space to be able to balance that with their work. It gives them the future opportunity of progression, and obviously when you do that, the retention is your aim in this game. Next slide, please. Now this has been a focus for lots of multinational enterprises of late, and the biggest one from Accenture, a huge international enterprise with 500,000 workforce, and they are one of the top consultancy firms. And they've actually proven the science behind having a diverse and more inclusive organization makes you something like 50% more successful than your peers who are, who are not doing the same thing. And that is actually incredible, because in a competitive world of commerce, if you have a 1% advantage, that is big. But when you're looking at such an enormous gap between those who look at the diversity and inclusion and practice it compared to those who don't, then it is a huge game changer. And hence you won't be surprised to see every organization these days are talking about diversity and inclusion. Not just it's the right thing, it's also good for business. Within the context of a health sector, where we're not talking about being financially better off, we're talking about managing our talent, our workforce, and the health of the people who actually keep the organization going. Next, please. Okay, well, I'm really all into disability, and there'll be great speakers later talking about other strands of the protective characteristics. So I'll focus on one major issue. Now, why now? Is because we've had 2 years of the worst pandemic we've had in the past 100 years, and it's taken its toll on the workforce, and that is happening. It's a kind of a perfect storm. We have years of hard work by the NHS employees, compounded by shortage of staff. We have the issues with Brexit, as well as this COVID-related illness and absenteeism. A recent survey done by NHS is showing that a quarter of the workforce are actually thinking of leaving the profession. Now that is a worrying, incredibly worrying situation, because you can't really replace those people. No amount of money is going to buy back the talent you lose. And why that is because people who need the support need to get it straight away. And I don't believe that employers have really got that one right yet. There is a long process, and sometimes no process whatsoever, for people to seek help and to receive the kind of intervention to help them to stay in. So really what we have to look at is what can we do differently. And time is running out, partly because really training people you lose is going to be very difficult. It takes years to do that. And in fact, if you ever wanted the bottom line kind of a calculation, the return on investment on retaining staff within the NHS is almost 100 to 1. For every £1 you spend, you retain, you gain £100. That's not exaggeration. A doctor takes nearly £1 million to train up to the position of practicing. And if you lose them, it's just, I would say, in any other organization, would be a disaster. So next slide, please. Now, what we have many years of practice in large enterprises, we often find the same issues at hand. Why employees who have health conditions, whether it's short-term, long-term, whether it's called disability or whether it's temporarily, the difficulty is there is no process. There is no defined process. There are no process owners. There is no senior champion. And this is one of the most important critical factors for a success of such a process. You need to have an exec level, somebody from the board level, who actually makes it a priority to look after the well-being and the work environment for the workforce. Because by that you can get more out of them. By that you can keep them at work longer, and you certainly won't lose them. I know financial aspects can impact on people's decisions whether to stay with an employer or not. But when people come to NHS, they don't come for money. They come for the passion for the service, to really save lives and help the community. Of course, they need a basic minimum for life securities, but everything else, it's down to the employer. to create an environment where they can be themselves, where they can be the best of themselves, and they can only do that if when they're struggling with a health condition, whether it's as a result of workload or as aging or any other factor, they need some support. And those supports are easily done, and this is not really impossible. However, as I said, the investment, return on investment is huge if it's done properly and at the right time. So the process should really well signposted, should have somebody looking after it, and more importantly, data needs to be collected, accurate data needs to be collected so that you can improve a situation. So that's an ongoing continuous improvement. And next slide, please. Obviously, this is not a small issue. We're not looking at the tiny minority underrepresented group. Although the NHS figures, recent figures, says 3% of people have declared disability. That's way below what the industry standard is. In the public sector, we know up to 20% of employees have declared disability. Within the NHS, the number would be even higher than this, quite significantly high. If you imagine the impact of the COVID, the mental health issues, in a musculoskeletal aspect, and aging, plus all the other factors that will affect us as human beings, I would say the numbers would be north of 30%. But they carry on working, and that is really where I think we really need to bring in the interventions that will look after their need at any time. And this is not rocket science. Some basic intervention well within the capability of NHS, but I don't believe that at the moment people are clear where to go for help, and I'm not sure whether managers understand those, the importance of those adjustments and how to access it and how to actually keep people working rather than signing them off on a long-term sick leave. I think collecting the correct data, as I said, is very important, but it's also important that the senior management take real interest in making sure the picture is improving rather than, we put a process and then it should work by itself. Next slide, please. Well, NHS is working on incredibly difficult areas in life. Saving one life is probably 100 times more difficult than setting up a process by which to help talent employees to stay in the business. And that really is where we think that it can be done within your own federal system. Doesn't need to be a national. However, having a nationally coordinated process by which all the trusts can work together and learn and share experience is something that will benefit. Also, there's a lot of expertise out there. We certainly have offered help to try to set up processes by which you could actually have a basic service running internally so that the employees who do need help can have access it and get the kind of support they need immediately. And obviously mental health is big. It's not about pills or magic bullet. It's all about understanding and caring and actually empathy that the employees need. And sometimes just having the recognition that they need some sort of emotional support in an incredibly difficult environment is all it is needed. But again, that requires a process, that requires formal structures by which people can actually ask for that service and receive it very quickly and timely. Next slide, please. Now, I would emphasize the point here is that you need all the components in order to make this a success. You can't have all the will, all the money, and just part of this. You need to have a business process that creates a business as usual, not a fringe, not something that we do that for time, temporarily. And that structure needs to be really thought through and very robust. Next slide, please. Now, I've worked in this industry for 30 years. we've helped around 500,000 people. And we know that even the hardest problems can be fixed with the simplest solutions. Technology is playing a massive role in NHS, in the health system. People are able to now self-manage their condition, and that is certainly something that the health organizations across the world are using more and more. But the world we're living is become very complex. We can no longer rely on the traditional ways of recruiting, retaining staff. I know many, many talented people within my family. About 8 of my family members have been to Southampton Medical School, have graduated, and they've become extremely respected members of community. 2 of them are actually in the system at the moment, and I know how the system is designed to attract the best. But what happens to those candidates in those 5-6 years is sheer hard work that gets them through. There are lots of areas where system could be improved to attract even more talented people who want to stay within the NHS. Lots of intelligent people come into NHS, find it difficult. They graduate, they maybe even work in the profession, but they leave. We can't afford that. That is really wasteful. There are newer ways, better ways of actually attracting the right type of a talent that who wants to stay in NHS, but may not be able to overcome the barriers in terms of educational attainment. Not everything really is determined by whether you are able to read or answer test questions in a limited time. There are quite substantial wasted talent out there that who could come in and do fantastic work for the NHS, but they would never be able to get through the medical requirement for medical school. The same goes for in nursing as well. We know that a quarter of the student nurses are dropping out before they hit the clinical stage because of stress and anxieties. Could be neurodiversity. There's a high percentage of them do have neurodiversity, dyslexia, and obviously, if the system is designed just purely for people who are able to provide, just the kind of academic standards that was designed maybe hundreds of years ago, they're not going to get through easily. So I think, again, we need to re-examine how we deliver our lectures to our medical students and nurses, and how we can make the education more inclusive. I know examples of 3rd or 4th year students with ADHD had to drop out because the system wasn't flexible enough or supportive enough to make sure that that individual gets through the rest of the course. Really talented student, but he couldn't cope. And I also know maybe 20, 30% of the students will struggle listening to lectures because they're not inclusive. They don't have handouts which are, in a way they can actually benefit from. And sometimes, according to one student I spoke to, said, well, with some lectures, we sit there and we doodle. We just play with our laptop because we can't hear even what the lecturer is saying. So I think, that is actually something that all education establishments are having to look at and to see whether they can improve the picture. But certainly in medical profession, if you look closer, you could get more out of your students, more your graduates, because you need to attract more. You need to keep more. So I think over the next 10 years, we have to really re-examine our education system and see whether we can actually bring more talent, retain more talent. A quarter of the workforce leaving, that's a massive gap in your employment kind of a challenge that you're going to have. So how you're going to address it is bring new talent, and there are thousands or maybe millions of disabled people out of work. Some of those would be perfect to do some of the work within the NHS. NHS being one of the biggest employers can benefit from those talents. And identifying what they can do and how they can benefit NHS is easy because there are tools out there you can use. Next slide, please. I mean, one of the one of the things that we've looked at in the past is NHS provides millions of documents to patients which are not accessible. Now, there's a legal requirement that has to be. We can bring people who are out of work, who have the talent to make those remediations for NHS so that the information is accessible to everyone. We know that deaf people also have problems when they come to A&E because the A&E staff are not trained to deal with deaf people. Again, there are technologies that you could embed within your GP practices and the hospitals to be able to to give a better customer service. I think the customer journey is important. It's not about just saving lives. It's actually making sure they feel valued and taken, made feel important. And I also feel that our frontline primary care doctors need better training, not only just to look after the patients, which often do get signed off long-term sick leave, also look after themselves. I had a experience of my own. He was retired now, but my own GP, where he was signed off for 4 weeks for a back condition, only because his working environment was terrible. I actually ended up giving him a chair, and he didn't have a day off for 2 years subsequent, and then he retired, partly because they don't realize that they put themselves under tremendous pressure and they don't look after themselves. So I think this is really more about being kinder to ourselves and looking inside, and the talent is there, but you need to do more to try to make sure they progress and they stay with you, because the nation needs you. And I think you've got everything it goes to actually make this a great, one of the greatest institutions that exist anywhere in the world. Next slide, please. Well, I mean, as the tagline goes, it is a world-class organization, and it's made out of world-class people, and they deserve the best. And I think the inclusion, diversity and inclusion strategy of the NHS should be more about action, should be more about people being valued, and I think the senior management should put as much emphasis on this than to actually frontline care, because they need to be hand in hand. If you don't care for your employees, they won't care for your customers. That is the motto within the private sector. So here we have the most giving, the most compassionate people. They need more, and that is not expensive, but it definitely needs to be done from the highest level. And thank you very much.
Thank you, Nasser. Thank you so much for that. Really, really interesting. I think we're going to invite some questions from the audience, if that's okay. Simon, I'm going to need a bit of help with that because I can't see the questions from the audience. Nasser, what would be your kind of top tip in your experience for organisations that are, some are a bit more further forward in this agenda, and some are a little bit, yet to sort of strengthen this side of their work. So what would be your top tip for getting real traction? What's worked most, do you think?
Well, I think biggest incentive for NHS or any employer looking at the employees and see how much, because often financial reasons are the reason why most organizations don't think they can afford this. Well, cost of not doing it is a lot higher than doing it, that's for sure, because there is a lot of hidden cost in terms of employee absenteeism, productivity loss, and obviously loss of employees and then having to recruit. In any industry, for every pound we spend, we can show £5-6 gain. In NHS, you certainly can show about every pound you spend, you could get £100 back, because your typical employees, like a doctor, takes a lot more to train to get ready than any other profession. So from that aspect, you don't really have a problem. The biggest problem for organizations, they don't think they can do it. Well, that's, I can say, it's easy to do. We've done it for so many organizations. NHS should be able to do it. And there is a myth about disabled people can't do the job, so why shouldn't we get somebody else? Well, it's not a conveyor belt. It's no longer possible to say, well, we've got a big talent pool who are just in their pipeline coming through. NHS is struggling to attract the right talent, and so you can't really wish that I'm going to get rid of one and then bring somebody else. So I think this is another area where we need to look at how are we recruiting, both in terms of graduates into university as well as into the NHS. Tools are available to identify the right talent for the right job. We should use those as well. And also the way we train them. And training them is very intense. We're trying to do too much in a short time, and certain people who work in different ways, differently able, will struggle to go through that. So again, that's an examination of how we could actually improve our training. A combination of everything. And so I think if the willingness is there, which there should be now, I think the problem is so huge that we can't throw money at it. Money is not going to solve our problem. So I think diversity and inclusion is certainly a way to harness all the talent we've got, try to find the best in our people and try to nurture it and to make sure they can give more.
Okay, thank you. So just a couple of questions coming in then. So first one is, how do we improve people declaring their disability?
Well, it is really it's a chicken and egg situation. If a disabled person feels they can get the support, they'll tell you. And if they don't feel you're going to support them, why would they tell you? And the other thing is, if that institution is very inclusive, why would they need to tell you? So you have to really first create an environment where people can trust you. And by that means, if they come to the line manager, say, I'm struggling, whether it's mental health or whether I've got some physical health issues, they don't just get dismissed. They don't just say, well, you are a troublemaker, leave me alone, and I've got other things to worry about. They need somebody to help them to resolve and remove the challenges they're facing. Once they actually get what they need, then you have a happy workforce and they have a committed and loyal workforce. We know that from the data we've got from years of working, that it improves the relationship between line managers and employees and improves productivity by about 50–60%. So that's the way to do it. You've got to create a system to create the trust, and people will come forward once you do. And once you're in a good place, they don't need to tell you, and then you don't need to know who's disabled.
Thank you. So questions coming from Vicky Forrest, who actually is one of the chairs of our staff network group for people with disability and long-term illness. So she says, many staff find the absence process a difficult one, and for manage it's difficult to navigate. Are there any tips to help improve this?
Yes, visibility. First of all, how do you track people's absenteeism and why they're absent? And what process do you have to bring them back to work? And this is where I was saying the workplace adjustment, or reasonable adjustment as the legal name is to make sure you can provide that adjustment intervention before they get onto the sick leave. You know, a lot of people will start with a minor issue where, NHS is a very difficult, challenging environment for people with musculoskeletal pain because, they're subjected to a lot of lifting and that can cause strain. The main thing is those early signs should be treated very quickly. Sometimes people don't think it's a big deal, but no, it is a big deal. It escalates. And then when they get to a situation where it's so bad, they have to get signed off. But being signed off doesn't mean they actually get the intervention to get them well back to work. They might rest for a while, come back to the same environment that made them sick. So you've got to realize that there are solutions in place, and sometimes redeployment is the only option. You can't really, put a nurse who's got a back pain back into the same job that made them in that situation. Find a different role that they can do effectively as well as the other one, but don't lose that talent, because bringing somebody else is not going to fix the problem, because there aren't enough people out there to do that. So, but there are systems in NHS that, there are platforms now, I know is used, some trusts are using, is essentially tracking the reason for absenteeism and then offering that intervention very quickly, and just need to align all their trust together so that they can use the same platforms.
Yes. And then one last question. The NHS and health and social care is under so much operational pressure at the moment. So how do we find space to focus on this?
Well, actually, you have one of the reasons why it is under pressure is because not enough people, the absenteeism could be high, so you have fewer people doing all the job. So look after the people who look after your patient, then you find the workload is shared among more people. And I think it is important. It is as important as anything else within your operational management that you need to have a healthy, working, committed, passionate, and motivated workforce. If you don't have that, then you get fewer people doing it, and those few people will be under more stress and strain, and they would also would suffer, and then the whole operation will suffer. So this is probably as fundamental as any other thing that you need to do for your workforce. Now, as I said, it's no longer a fringe activity. It certainly should be front and center of every organization, particularly with NHS, because we need them. The nation needs them, and I think we could do better for them, and we should do better for them.
Absolutely. Thank you so much, Nasser, for your time and your insight. Really, really appreciate that. Thank you so much.
Thank you as well. Thank you, and I'll see you later. Thank you.
Bye. Bye.